Assalamualaikum warahmatullahi wabarakatuh. Today I will discuss about the femoral triangle area. What is femoral triangle area? What is the important things about femoral triangle area? Basically, the femoral triangle area is very important because of there are very important neurovascular structures pass through these femoral triangles. And this femoral triangles basically is located at the anterior and also middle aspects of the thigh. Femoral triangle basically consists of three borders. It has superior border, it has lateral border, and also medial border. The superior border basically formed by inguinal ligament. The superior border basically formed by inguinal ligament. This inguinal ligament basically extends from the anterior superior iliac spine and attach into the pubic tubercle. Lateral border basically formed by sartorius muscles, and also the middle border formed by adductor longus muscles. So we have superior border coming from inguinal ligaments, lateral border formed by sartorius, and middle border formed by adductor longus muscles. Now we talk about what is the flaw of the femoral triangles. The flaw of femoral triangle basically formed by muscular structures from the lateral to medial. The most lateral flaw of the femoral triangle formed by iliopsoas muscles. Just underneath these neurovascular structures, we have muscles known as pectineus muscles. Just underneath these neurovascular structures, we have one muscle over here known as pectineus muscles. And the most medial muscles over here basically formed by adductor longus muscles. So I repeat, the flaw of femoral triangle basically formed by lateral to medial. We have iliopsoas, we have pectineus, and also we have adductor longus muscles. And all these structures basically covered by deep fascia known as fascia lata. Now we will discuss about what is the content of the femoral triangle. From lateral to medial, the most lateral structures of the femoral triangles, basically what we can see here, the yellow color structures, this is femoral nerve. The femoral nerve basically coming from the spinal cord at the level of L2 until L4 roots. These femoral triangles cross the inguinal ligaments inferiorly and enters the femoral triangles and supply the hip flexor muscles such as iliopsoas, sartorius muscles, and also this femoral nerve basically supply the knee extensor muscles, which is quadriceps femoris muscles. Medial to the femoral nerve, the red color structures, this is femoral artery. The femoral artery basically coming from the external iliac artery and cross the inguinal ligaments, and what you can see here, this is femoral artery, and femoral arteries basically become chief arteries which is supply the whole lower limbs regions. And the most medial structures, the blue color here, this is femoral veins. The femoral vein is very important because of it drains blood from the whole lower limb, and also what we can see here, the femoral veins, what we can see here, there's one vein which is attached into the femoral veins, which is this vein known as great saphenous veins. So inside the femoral triangles, not only we can see femoral veins, but also we can see this great saphenous vein. just medial to the femoral veins. There's one small space or canal over here, which is this canal is very, very important, known as a femoral canal. This femoral canal basically is very, very important because of it allows the femoral vein to expand. And also inside this femoral canal, right, I label these structures. This is femoral canal. So it allows the femoral vein to expand, and also this femoral canal, inside the femoral canal, what we can see here, there are a group of lymph nodes known as deep inguinal lymph nodes. And number 3, the important things about femoral canal is this is become a potential area to become femoral hernia. So, what is the clinical importance about the femoral triangles? Number 1, just inferior to where the femoral artery crosses the inguinal ligaments over here, it can be palpated to measure the femoral pulse. Number 2, the femoral artery is located superficially within the femoral triangle and is thus easy to access. This makes it suitable for a range of clinical procedures. For example, the most common medical procedure that has been done is coronary angiography. And the last one is the femoral canals become potential area of the femoral hernia. This manifests clinically as a lump in the area of the femoral triangles. It usually requires surgical interventions to treat. Okay, that's all for today. Thank you.